Ask the Expert is sponsored by Intermountain Healthcare.
Okay, February is all about your heart, right? So heart health is the topic of our Ask the Expert segment today. We have Dean Carrington here, a nurse from the Intermountain Medical Center Heart Institute, to talk a little bit about, aortic valve disorders. How do you know if you have something wrong?
It's hard to tell. Sometimes you start getting short of breath or fatigue. Those are the two biggest symptoms. Some people do get some chest pain, but those are the big three symptoms.
Okay, and stenosis, is that one of the disorders?
That's one of the disorders. What happens is your valve will open and close normally. As it starts to calcify, it doesn't open, so you don't get the blood flow coming through that valve that you need to keep your energy up.
You need that blood flowing full speed.
You do.
To get everywhere in your body.
Correct.
Okay, then what can you do to fix it?
There's two main ways. There's like the Dr. McCann's last thing where the tox go and opens up the chest and opens it up.
Right.
Or the team I work with, we do it transcatheter replacement. We will go through the leg like an angiogram, go up and put a valve in that way for people that are higher risk for surgery that they wouldn't want to open up with a typical surgery.
What are some of the first symptoms? You were saying like just short of breath?
You start getting short of breath, fatigue, you just don't feel right.
Doesn't that come with age?
It certainly does. So yeah, you got to get it diagnosed with echocardiograms.
Okay.
Yeah.
And if you have like chest pain, pressure, tightness, it might not be a heart attack, it might be something else.
Very true.
Okay.
Yes.
And if you faint and you didn't used to, or palpitations?
Correct.
And then you just don't feel like you can do as much.
That's right. You start getting your family will start telling you, Mom, Dad, you're not quite getting around like you used to. So.
Okay, and then just go to the doctor.
Right, go to the doctor. It's a simple test to find out if you have it. Basically, an ultrasound or an echocardiogram of the heart to see if the valve's opening right.
And the technology is amazing.
Oh, it is.
You can fix almost anything.
We can.
If you call in time.
That's right.
Okay, well, and you can call now. Have you had some good questions here on the panel?
Some very good questions here.
Okay, and people asking about what?
Anything from blood pressure to cholesterol to just typical coronary disease questions. So.
Okay, and you know what? Doctors will usually take calls, and so will nurses.
Yes.
And we'd rather have you do that than go to the emergency room.
Yep, that's exactly right.
Okay, and they'll take your questions today, free of charge, free advice. These are real experts here, and if one of them can't if you don't have the answer, you have somebody sitting right next to you who can.
We do. There's 8 of us here to do this.
Okay, and it's a toll-free number from around the state, 877-908-0680, or go online, go to our Twitter page or Facebook and use the hashtag KUTV Ask the Expert. Back into you.